Assalamu alaikum. Hello and welcome to Care Across Cultures, where we explore health and wellness across our diverse communities. I'm your host, Mirban Hussain. I hope everyone's okay. Hope everyone's had a good weekend. And Eid Mubarak to all of my listeners. Amazing. I had a wonderful Eid. I hope you had a wonderful Eid as well. Today we're exploring how something called the Big Purple Bus is revolutionising healthcare access for communities. My guest today is Wendy Burkitt from Western Park Cancer Charity and the Big Purple Bus. I don't know if anybody knows about the Big Purple Bus, but that's what we'll be talking about today. It's an amazing service. You're listening to Care Across Cultures on LinkFM 96.7. Our studio hotline number is 0114 261 8181. And WhatsApp number is 07939 849 please join the conversation. Ring us, call us, and ask us some questions. Perhaps you want to share. If you use the Big Purple Bus, we'd love to hear from you. Share your stories. What was your service like? What was the service like? Was it good? If it was bad, we've got Wendy here and we can definitely talk about that as well. If you don't want to phone, then send us a message on WhatsApp. As always, the views and opinions expressed on this program belong to me and my guests, and are not necessarily the views and opinions of LinkFM or of the organisations that my guests and I represent. I'll be back with you shortly. Hello and welcome again. Today we're highlighting the Big Purple Bus. I'm going to welcome my guest today, Wendy Burkitt.
Morning.
Hello Wendy, how are you?
Good morning, I'm very well, thank you.
Thank you so much for taking some time out and coming to talk to us. And sharing some of your knowledge around what the Big Bus is and cancer and all these other kinds of things.
You're very welcome, it's my pleasure.
Thank you so much. So, Wendy runs the mobile healthcare service, the Big Purple Bus, which brings culturally sensitive medical care directly to underserved communities. Now, whilst some traditional healthcare has failed some communities, the Big Purple Bus is putting healthcare on wheels and building trust where it's been broken. Over the next hour or so, we'll discover how this simple but powerful idea is tackling health inequalities and transforming lives in communities that have been left behind. So Wendy, I've got a lot of questions for you.
That's all right, I'll try and answer them.
Thank you so much. So the first question is that, what is the Big Purple Bus?
So the Big Purple Bus is a more accessible extension to the Western Park Cancer Charity Service. which for years and years has provided support, emotional welfare, advice for people who were experiencing changes because of cancer. So that doesn't necessarily mean that they are diagnosed with cancer. It can be a family member, it can be friends. So that service has been available for a long time at Weston Park Hospital. But we found that there's an awful lot of communities around the South Yorkshire area that are not using those services for lots and lots of reasons. So the project started a couple of years ago where someone, thought, how do we get into communities that have got a higher incidence of late stage diagnosis and a lower incidence of uptake in services. And so lots and lots of research went into those numbers and looking at them over a substantial amount of time, so that we could figure out where we're best placed these external community services. So Macmillan had a service already that was using the bus. I think they sort of used that model to start off with, and we purchased 2 buses, set up a team, which they recognised quite quickly needed healthcare professionals. So the healthcare professionals out in the community, going to areas that are not necessarily accessing or being informed or having an understanding of what is available to them. And that is just normal diagnosis, normal standard testing, things that are quite accessible to most people. That's what we're putting into the community. So we arrive on the bus, we've got that healthcare knowledge, we've got the healthcare information, we've got connections to lots and lots of other services throughout the NHS. We've got the information and the knowledge to be able to advise people if they've got any kind of queries, worries about cancer, if they've got family or friends who are struggling with cancer diagnosis, or people who've been bereaved because of cancer diagnosis. So that's the main reason.
Right, okay. So these buses, the Big Purple Bus, are they in one specific place, or do they move around?
So we have areas that we have, obviously looking at the research, we understand are the areas that have got that, as I said, a low uptake and services. So we have, by talking to the community and by talking to councils, they've organised to go to these areas, and we do move around. So we go to Manor area, Arbourthorne. We have a stop at Meadowall, Parson Cross. We have Darnell and Tinsley. We have Breathing Space in Rotherham. We have Sackmer. We have a lot of, organised stops that we go to regularly on a monthly basis.
So is this just for sort of Sheffield and Rotherham, or is it more?
It's going to be branching out. I mean, at the moment we concentrated the first phase of funding. We concentrated on Sheffield, predominantly Sheffield area. We are going to be moving out to Doncaster and Barnsley. That's us next areas, Rotherham, Doncaster and Barnsley.
Right, okay.
So we're going to be providing services to them hopefully in the next sort of phase of funding.
Amazing, thank you. Help me understand, and also my listeners understand. You call it the Big Purple Bus. What does it look like? What is it?
It is a single-decker bus.
Yeah.
It's a big purple single-decker bus that says Weston Park Cancer Charity all over it in purple. We usually have got our staff uniforms on, so we're easy to recognise in the community. You can often find us stood on, on the corner outside the bus, giving out leaflets, speaking to community groups, going into community centres, going into GP surgeries, trying to encourage people to step on board. The bus is brilliant. It's like it's a very friendly place to come, because you can have a drink, you can have a biscuit, you can have a chat. We're there to help people, and it is a drop-on service. You don't need an appointment. If you see the Big Purple Bus anywhere, feel free, just come on and ask questions about what we're for.
That sounds really good. So that's one way of reaching those communities who may not usually access services. I've got a question for you. What personally drove you to do this kind of work?
So, being in the Sheffield area, right in the town centre, it's very easy to access the services if you are. You've got easy transport. Your English is your first language. You come to the Hallamshire and Western Park, which is where I've worked. There's an awful lot of communities that I've seen personally, because I lived at Eastwood in Rotherham. That's my community, and I think that's the main reason that drove me to want to work out in the community, as opposed to my 25-year career of being in an NHS building. I wanted to come out. Of probably people who know me know that I like to talk anyway. So,
well, you're on the right programme to talk.
Use that to be able to get across to people. I love being out in the community. I love talking to new people. I love that whole feedback that I get from people that say thank you, glad you've come, that's information we didn't know, that's information we didn't understand. So that's what's driven me to do it.
So thank you for that. So आज हम बात कर रहे हैं Wendy Burkitt from Big Purple Bus. ये एक ऐसी सर्विस है जो कि हर आदमी के लिए है. It's for everyone. तो ये इंफॉर्मेशन देते हैं, मालूमात. अगर आपको कोई सवाल है कैंसर के बारे में, कोई भी हेल्थ इशू के बारे में, तो अगर आप इसको देखें, ये जगह जगह पर शेफील्ड में, रोदर में भी होती है. आप अंदर जा सकते हैं, इनसे आप बात करें, तो ये जो है ना आपकी पूरी मदद करेंगे. Right, so I would just sort of translate a little bit of what you talked about. I want to talk about health barriers that communities face, especially ethnic minority communities. But I want to widen that in terms of underserved populations.
Yeah.
What are the top 3 health barriers that you've come across in the Purple Bus that communities face?
The biggest one for me, I think the first one is a language barrier. So every week we're coming to communities and realising that we need the information producing in different languages. And unless someone comes to us and says, have we got this in Somali, have we got this in Urdu, whatever that language might be that it's easier to read, we can get that information. We can get that translated. We can do our best to provide something. So I think that barrier of may well see the adverts, you may well see the posters, but if they're not in your language that you understand, you won't be able to understand that service is available.
Of course, yeah.
So
and yes, translating leaflets is fantastic. It's really useful. What about on the bus itself? Do you have people who speak different languages?
So what tends to happen in the communities that we go to, they've got people that work in the community centres or work at the GPs that are very good, much like yourself, Mervan, that can interpret. I don't speak any other languages, unfortunately, than English, but some of the communities in Fir Vale, for instance, one of the ladies has been coming to the bus every time we park once a month. She's come on board and interpreted for the other ladies that have come on who don't speak English as a first language. She's now been employed by the community centre and been given a permanent role as part of the community service. And so that's led from her coming on voluntarily every month, interpreting for these beautiful women who come on board and are trying to explain to me what's happening to their bodies physically. She's interpreted, we've got it sorted, we've spoken to GPs, we've had a massive impact, and that's personally had an impact on her because then she's been offered a job. So,
oh, that's an amazing story, isn't it? So a shout out, I suppose, to all the listeners. So if you want to volunteer on the Big Purple Bus, get in touch with you.
Yeah, absolutely. Yeah, we have a couple of people who volunteer for the bus who speak more than English, who speak a lot of languages, and they're invaluable. They're perfect because when we go to the mosque on Fridays, they're there. They come to the school at Tinsley, can speak to people in lots and lots of different languages and get that message across. And they know they can come and ask questions. And Naseem's there, and she can interpret for us.
Well, fantastic. That's really great. So, अभी हम बात कर रहे थे कि मैंने सवाल किया कि बिग पर्पल बस पर आप जो है ना जो मालूमात देते हैं उसके किन किन ज़बानों में देते हैं. तो वेंडी कह रही थी कि वो तो सिर्फ इंग्लिश ज़बान बोलती है, जो लीफलेट वगैरह हैं वो तो वो ट्रांसलेट कर सकते हैं. लेकिन अभी उसने एक स्टोरी शेयर की है जो कि एक औरत थी जो वॉलंटियर करती थी उनके साथ. तो हर हफ्ते में वो आती थी तो लैंग्वेज जो है ना इंटरप्रेट करती थी. तो अभी जो है ना वो जिस सेंटर में ये बैठते थे ना उसको अभी वहाँ एक नौकरी मिल गई है. तो अगर आप सुनने वाले कोई भी बिग पर्पल बस के साथ वॉलंटियर करना चाहता था तो अगर आप बिग पर्पल बस को गूगल करें तो टेलीफोन नंबर मिल जाएगा. तो आप जो है ना इनसे रब्ता करें तो हो सकता है वॉलंटियरिंग के साथ आपको भी कोई जॉब मिल जाए. If you just joined us, you're listening to Care Across Cultures on LinkFM 96.7 with me, your host, Mirban Hussain. I'm talking to Wendy Burkitt from the Big Purple Bus. We're talking about what the Big Purple Bus does, the services it provides. So we talked about health barriers. The first one you said was language.
Yes.
What's another one that you've come across?
So culturally, I'm learning a lot every single day. So from where I was at the beginning to where I am now, I understand an awful lot better about words that are better to avoid, conversations that are easier to have with an all-female group of people or an all-male group of people. So culturally, that's it. I've found that I understand better what is more helpful to separate women's groups and men's group. There's an awful lot of stuff going on culturally that I didn't understand, especially with regards to language and words that you use and how you talk about specifically body parts and medical procedures. So that's that's had a massive effect on me because every day has been a school day and I learn every day, and I'm constantly asking the community, what words would you like me to use, how would you like me to describe things, what's a comfortable way to talk about this subject. And that's why I'm learning every day what's comfortable for the people that are out there that want to talk about these things.
Yeah, thank you so much for that. That's one of the reasons that both you and I collaborate on providing cancer awareness training with Rotherham Hospice and Western Park Cancer Charity when we go out into the communities, because we understand, as you just rightly said, that there are some communities who don't want a mixed audience, and they don't want, women may not want a man to come and talk to them about some female specific cancers.
Yes.
Body parts you mentioned and those kinds of things.
Yes.
And then it's much more sort of easier and more appropriate.
It makes it more comfortable.
And more comfortable.
To use the right words that people
Yes.
feel comfortable with. It makes them engage with a conversation and stops them from withdrawing because of embarrassment, or they don't want to be part of that conversation because it's talking about specific body parts.
Because that also is a challenge, isn't it? Because if you are going out and raising awareness around cancer and talking about female body parts and female cancers, or even male body parts and male cancers, and if there are a group of people there and who may potentially know each other and they don't want to sort of mention that kind of stuff and they don't want other people to know.
Well, that comes back to the third point, the accessibility. So I always provide everybody with my number. they can always contact me personally, like directly afterwards, or they can come and see me. I always give them timetables. They know exactly how to get hold of me. So if we're in a group setting and somebody's got something that's personal to them, or that is specifically gender related questions, they can ask me privately about that.
Yeah.
So they may not want to talk about it because there might be a male present, or there might be a female present, but that accessibility is a huge thing.
So it's much more than just the Big Purple Bus is much more, from what you're telling me, than just a place where people go for information. It provides much more support and personalised support.
Yeah, so a lot of people contact us personally. We've got phone lines, we've got all the literature has got our phone numbers on, and you can speak directly to a healthcare professional. You ring that number, you can ask to speak to a healthcare professional, you can get a referral, you can go on the website and ask to speak to someone, give them a ring, and that is an healthcare professional who can directly speak to you one-to-one in a personal setting. They can arrange a face-to-face and have an emotional support if that's what you need, or they can give you medical advice and, you know, tell you where to go and get testing done, or whether what to go and speak to your GP about. Some people don't actually know what their next step is when they've got something that they're worried about, and so that's the accessibility bit. We're providing somebody out in the community. They get to know us, they know our team. We've been there for months and months. In some cases 18 months we've been in the same location. They become familiar with us, they know that we're trustworthy, they know that we do what we say we're going to do. If they are asking for help, we get them help if we can, and that's how the word spreads then, because they're not making their way to Sheffield to speak to somebody. They're coming to their own community. They're speaking to people that they know because we've been around for a long time. And that group of people then can spread that word, and they can come and see us. We can sort it out. And if we can't sort it out, we'll find someone who does.
That's amazing. And we're just coming up to a commercial break in just under a minute or so. But when you said healthcare professionals, name a few healthcare professionals. You've got less than a minute before we're going to break.
Right, so I'm a radiographer, so I worked in radiotherapy and gave radiation to people who are having cancer treatment. There's nurses, there's doctors, there's physiotherapists, you know, people who have trained medically and understand a certain subject. Yeah, that's
great.
Healthcare professional.
Thank you so much for that. We're just going to go into a break now, commercial break, and we'll be back shortly. Thank you for listening to Care Across Cultures with me, your host, Mirban Hussain.
Your unwanted clothes can make a big difference in someone's life. Clear your wardrobe and help the less fortunate in their time of need. This will protect the environment and free up much needed space in your wardrobe. Do a sadaqah today and drop your unwanted clothes at the Clothes Bank at Pakistan Muslim Centre, Woodbourne Road, Sheffield S93LQ. For more information, call Families Relief on 0114 365 4454 or 07419 299 729.
जो होएगी एक्सीडेंट फिक्र ना करो फटाफट द क्लेम टीम की फोन करो अगर तुम टैक्सी चलाने हो तुम प्राइवेट हाथ चलाने हो या फिर कोई किराए नी गड्डी ना एक्सीडेंट हो गया है ते द क्लेम टीम तुसां दी खिदमत विच हाजिर है जेड़े शफील्ड दादरम ते गिरदोन वाले इलाकियां विच टैक्सी ते प्राइवेट हायर गड्डी तुसां की मुहैया करने द क्लेम टीम अपने वादे ने मुताबिक 2000 पाउंड तक रेफरल फीस भी देने ने उन्हां दा फोन नंबर है 0330057109 या विजिट करो 78 Kimberworth.
Hello and welcome back to Care Across Cultures. With me, your host, Mirban Hussain. You're listening to us on LinkFM 96.7. Our studio hotline is 0114 261 8181. WhatsApp is 079 398 49339. Love to hear from you if you want to give us a call or send us a WhatsApp message. What do you think of the programme so far? Have you got any questions for Wendy or for myself? Have you got anything that you'd like to share? Perhaps you've got a story that you want to share. Perhaps you'd like to come on the programme. If you do, get in touch with us. And you could be here next week sharing your story, or perhaps you're a professional working within cancer and life-limiting illnesses across South Yorkshire or anywhere else in the UK. Perhaps you've got some wonderful stories of a service that you provide. Perhaps you've got a story of challenges you've overcome. We'd love to hear from you. We're going to go back to Wendy. Wendy, we were talking during the commercial break, and there was a question I was going to ask you about. How do you build trust in communities that may already distrust healthcare services?
First of all, it's turning up. It's the being present and being accessible. If someone comes and asks me a question, I'll always do whatever I can to help. Usually, if I can't do something, I'll try and signpost them to somebody else who can. And I think that just turning up, being present, the information that I gave, I don't turn up with a PowerPoint presentation. It's not a teaching session as such. It's a conversation with the community group, building that trust, building awareness. They see me come in every time. They know they can ask me any question they like. They know that I, don't use particularly technical jargon. That builds trust. They see me. They know they can come and ask me whatever they like. And I think that's the main thing. It's that building that trust.
Trust. So once you've built the trust, how do you maintain that trust?
So I think by that turning up and being present is also, when they ask for information, it's signposting to the right place. It's talking to community members. We've had, we talked about a story, and that one of the success stories. I mean, there's many success stories, but we had a group of ladies that I went to speak to, and English wasn't their first language. They had an interpreter there. It was a gentleman there, and I think he was a little bit embarrassed about some of the conversations we were having. I didn't organise the interpreter. It was organised by the community group, and they were quite happy for it to be a man. And actually he fared really well. And during that session, out of the 25 ladies that I spoke to, I think I had 10 women come to me afterwards to speak to me personally about things. One of which in particularly had a very noticeable lump on her breast. She had not been to the GP because she didn't realise she could ask for a female to examine her. She didn't speak very much English at all. I think she'd been living in the country for a couple of years, so she just wasn't used to our healthcare system. I sent an email to the GP and explained that she needed an interpreter, and that she was quite scared to come, and that she needed female. And actually they referred her straight to the breast screening because they couldn't provide a female doctor to examine her on that day. She went straight to the breast screening service, which is females, and they gave her a mammogram, did the testing that they needed, and she had breast cancer. She successfully had that treated and had the all clear. So if she'd have not come to that session that day and had an interpreter, be it a male or a female, having that information on that day, getting that diagnosis, saved her.
And that's such a powerful story about just what the impact the bus has. It's just about going there and talking to people. Yeah,
share that information, encourage them to be honest, encourage them to know what's normal for them, and to report it if something changes. That's always my message.
But you do much more than that just by giving information. What you've just said about that lady was that you actually did something physical afterwards, getting in touch with the GP.
And I often do that. I often have conversations with GPs, because I think if you highlight as a healthcare professional that you've got a concern about somebody, it's difficult to ignore that. That's not just a patient, a client coming time and time again to the GP to say, I'm worried, and being fobbed off or sent away, or there's not enough time, or they can't get an appointment. That they will, on most occasions, take notice of that email, and so we can email if we need to. If you've been turned away, or you've not been listened to, or what, there's lots and lots of reasons. GP capacity is quite high. So, yeah.
But that's a wonderful story. Thank you so much for that one. I've got some other questions. What health conditions do you see most often, most frequently, that could have been prevented earlier?
So, for men, particularly men who are not aware of the fact that changes to their normal routine, their bathroom habits, can indicate that something can be wrong. And it can be something that's very, very treatable. It's 100% treatable. If you go to the GP and there's some changes and they've been happening for a while, they can catch prostate cancer quite easily, bladder cancer easily, all sorts of things, and bowel cancer. We have a fit test that are sent out to everybody. They're called a fit test. It's a little sample kit that you sent after the age of, it was 55, but they're bringing that down. Many particularly don't want to do that. I've found that they're sort of not encouraged to do that, but get it done, get it sent in.
And the thing about the fit test and the bowel cancer specifically within men is that just because you're doing a test
doesn't mean you've got cancer. And usually, if you do have some blood when you use the bathroom, it's not always a sign that it's cancer. It's a sign that something's changed and that needs to be investigated. But more often than not, it's not cancer-related cause. It's something else that can be easily treated. It can be an infection, it can be all sorts of things going on that can be easily sorted out. I mean, for women, it tends to be breast cancer. If you check your breasts regularly, you can find lumps that can be investigated, and that can mean that it's caught early and it's easy to treat. Not all breast cancers are found by doing your breast examination. We have regular checks that you're entitled to go to for free. That's to have your mammograms done by the NHS, and that's free. It takes about 10 minutes. It's always done by women, but checking your breasts regularly, once a month, between your cycles, is a really good way to feel whether your breast health is good.
And the thing about breast cancer is that if it's found at the first two stages, there's a 100% success rate that you'll be cancer free. If it is cancer, it may not be.
And often it's not cancer. It can sometimes be a fatty lump, it can be a little cyst. You can have those for the rest of your life and nothing happen. They're monitored, keep them monitored, keep an eye on them yourself. When something changes, on your body, that's when you need to report it. If it's there for a while, for more than a few weeks, and it doesn't turn out to be a spot or a bit of irritated skin, that's when you need to look into what it could be. And more often than not, it's not a cancer-related cause. It's something else that's easy to treat.
And the same thing with, I think, is it passing water? Because sometimes, if you have a water infection, it may not necessarily be cancer or prostate. It might just be a kidney infection.
And sometimes it can be age-related changes. So my father, for instance, had some changes that my mother noticed and that my father didn't want to report, because I think he automatically thought he'd got cancer. And as it turned out, he just adjusted his lifestyle a little bit and didn't have, lots and lots to drink after 9 o'clock at night. He adjusted it personally for himself. After the test came back and it was all negative, and it wasn't prostate cancer and it wasn't bladder cancer, it was just the fact that he's 83 and these changes, you know, happen. He did go to the bathroom more often and it wasn't anything to worry about, but he did the right thing. My mum did the right thing, badgering him to go. You know.
So an important message there is that it may not be you as the individual, but your husband, wife, other members of your family.
She noticed. Yeah.
They will notice differences, and if they do, don't bite the head off. You know, just listen to them. And go and get yourself checked out.
Well, actually, you can do what my dad did, which is came home and said, "I told you so. I said it was nothing to worry about." And actually, that was the case. But my mum felt much better. Everyone was happy. We all knew it wasn't anything significant.
Yeah, that's great. That's great. How do you measure success? What are your sort of key outcomes on the Big Purple Bus?
I mean, personally, every one person that comes back to me and says, "Thank you for sending me to the GP," or "Thank you for noticing that it was cancer, I've had my treatment and I'm better." So put that aside, that every single person is important, and that every win, that's a win. We look at the numbers. So we spoke to 10,000 people last year.
Wow.
So, but you know, those numbers count. That's a lot of people.
That's a lot of people.
And that's people that wouldn't have been spoken to if we'd have not been out there. You know, we've got, I think it was about, I haven't got my numbers in front of me, but I think there was about 5,000 people spoken to on the bus, you know, just in the communities, to speak about cancer and cancer-related issues. Not necessarily always patients, sometimes family and friends of people diagnosed with cancer. And obviously bereavement plays a big part as well. We can support people afterwards. But yeah, those numbers at the end of the year tell us that we are having a significant impact on the community and how many people we're actually speaking to.
Amazing, amazing. What's the most surprising thing you've learnt about healthcare needs in ethnic minority communities?
The most surprising thing, I think, is move away from what people tell you is the truth and move towards what is the truth. And every day I go in the community and I speak to people who want to stay well, they want to understand cancer, and they want to understand how to keep themselves safe and the family safe. And that is a revelation, to actually speak to people and say, we want to know how to keep ourselves well, we want to know how to diagnose these things. That's, you know, breaks that myth, doesn't it, that people aren't interested or don't want to know.
Yeah, because there's that sort of hard to reach terminology, and the other one is that they look after their own.
Yeah, in actual fact, they want that information. They want to know how to keep themselves well.
Yeah.
You know, and we're out there doing it, and that's what they want. They want to know the signs and symptoms. They want to know how to get free testing. They want to know that we're available to help if they need it.
That's great. Thank you so much. If you've just joined us, you're listening to Care Across Cultures on LinkFM 96.7 with me, your host, Mirvan Hussain. I've been talking to Wendy Burkitt from the Big Purple Bus, a community service provided by Western Park Cancer Charity. Currently it's available in Sheffield and a couple of places in Rotherham. We're going to talk about, and this is a community service, a bus that goes out into the communities. There's a couple of mosques that it's at, and you know, some community centres. It's about making services more accessible, as Wendy's been saying, that if you see the Big Purple Bus, just come and go in and go and talk to people. So the question I want to ask you now is, what's your biggest current challenge that our listeners could help you solve?
So spreading the word, definitely spreading the word. So you might come to an education session or an information session, and the biggest challenge is spreading that through the community, getting people to understand that we're there, we're free, it's a drop-on service. That's the biggest challenge, I think. And by spreading the word through GPs and primary care networks, I think that is getting healthcare professionals. That's probably the biggest challenge, making healthcare professionals aware that this service is here. So it's not the community, it's the professional people themselves are not aware we're there. They don't necessarily always refer to us. You know, that's probably the biggest challenge.
So health professional can refer to you directly as well, then?
Yes, we get a lot of referrals straight through the website. So the Western Park Cancer Charity website, people can refer through there. So we get a lot of referrals from community, from GPs and other healthcare professionals.
I know I've come across some people within the community, and I've told them about the big purple bus at Breathing Space on a Thursday and said just go there. But I could also sort of, I suppose, get in touch with you direct and say, give you those details.
Yeah, you can go on the website, fill there's a form, just fill in the basic details of how to contact the patient with phone number and a basic understanding, so that we know why they want contact, whether that's for emotional support, a financial support, transport, help with transport to get to their appointments. There's an awful lot of things that we can offer on the bus that are part of the charity. We do provide transport for people's appointments to Western Park. If they're wanting, that's got lots and lots of pickups from Rotherham and Sheffield and Barnsley. There's lots of areas that covers.
So it's much more than just a place where you go for information and advice.
Yeah, we have welfare advice.
You're linked in, to Western Park Cancer Charity and other organisations as well that you can, the appropriate organisation.
Mm-hmm. We have citizens advice.
Yeah.
We have so many hours of citizens advice help a week. So if people have got financial issues with regards to the cancer diagnosis, so let's just say they're in the middle of treatment and they can't work because they're too poorly, and work are not quite as understanding as they need to be, or the benefits need to be changed, we have links to citizens advice who specifically speak to people with a cancer diagnosis, so they know what benefits are available. They can advise the person and help them fill the forms in. There's an awful lot of things available. We have complementary therapies, relaxation, hypnotherapy, all sorts of things. Hypnotherapy and relaxation can often be helpful if people have been diagnosed with a cancer and are waiting for treatment or surgery. All that can be organised on the bus. These complementary therapies, citizens advice, welfare, legal advice for wills, and probate and things like that can all be accessed from the bus in the community.
I've learned so much today, because although we have been working together for about 6 months, that I wasn't aware of all of these things that, all of the services and the support that you provide. So we're coming close to the end of the programme, and I've still got some more questions I'm going to be asking Wendy. You're listening to LinkFM 96.7. Care Across Cultures with me, your host Mirban Hussain. If you'd like to ring us, call us, send us a message, if you've got any questions, any queries, please do so. Okay, so I had a question I was going to ask you, but I think you've already answered it. What makes your culturally sensitive approach work where others have failed? But I think you've already answered that one, haven't you? It's because it's that building trust
and listening to what the community needs,
and actually listening to people.
Yeah, when we approached the mosque on Sheffield Road, we weren't sure whether they would want us to be involved, and they do. They want us to be there. They want us to help, and their ask was to provide things like access to blood pressure monitoring, diabetes information. They were the things that they wanted. So we've altered our things that are available on those days to provide what they need. That's what they've asked for, that's what they need. So we're taking that along, and we have collaborations with those groups and collaborations with blood pressure monitoring, diabetes, and so on and so forth. So the communities ask us for what they need, and we do our best to provide that service.
But that's because you've got this, you personally have worked within the NHS for 25 odd years, and as an organisation, Western Park Cancer Charity, you've got lots of links with all of these other service providers.
Yeah, absolutely.
So you talked about collaboration earlier on, didn't you? How important it is that all services collaborate, because not one of us knows everything.
No, we try to schedule our diary through the year and focus on cervical cancer month, or like womb cancer is this week.
Yes, it's Womb Cancer Week, isn't it?
So we try to focus on those, as well as the underlying normal provisions that we have. We also try to highlight those things. So when it was melanoma, when it was Skin Cancer Month, we had a melanoma focus day in Sheffield. We gave out sun cream. We were outside the cathedral. We spent all day. We spoke to 100 and something people on that day who asked questions about skin cancer and skin cancer prevention, and sun damage and all those things. So we do try and focus on certain things and take that what the community needs to them.
Thank you so much for that. I'm just looking at the time there, and we haven't got a great deal of time left. I want to talk about, if there was one thing that you could change about healthcare delivery to underserved populations, what would it be?
It would probably be more access to things in other languages, interpreters. I think for the communities that we serve, that's one of the biggest barriers. It's that accessibility. I don't think the provisions are there for people to be able to go to the GP's appointment and have an interpreter. I don't think the provisions are there for all the information that we stock. We do our best to try and provide that in different languages, but I think that's...
So language is still an issue.
A massive issue, yeah.
Although the breakdown of the ethnic minorities and underserved population in the country has changed significantly.
Yeah.
Now we've got lots of sort of Eastern European languages, haven't we?
Yes.
Slovak,
We
Romanian, Polish, and all those kinds of things as well now.
It's a constant change. We're constantly finding languages that we've not got information for. So we're constantly developing that on a monthly basis. We're asking our marketing team to get our information done in different languages. So that's going to always be a constant, battle, if you like, to provide everything that's needed.
But you're changing as you're going along.
Absolutely.
Yeah. What are your hopes? I know we mentioned briefly that currently the Big Purple bus is just in sort of Rotherham, one place in Rotherham and Sheffield.
Yeah.
And I also understand that Western Park Cancer Charity and Cavendish Cancer Care have sort of come together, haven't they?
Yes.
So is this going to have an effect on the Big Purple bus?
I think it'll have an effect on the service, not necessarily the Big Purple bus, because we don't know what the plans are with regards to Cavendish joining us. They've got a lot of services that we don't have, so from our point of view it's increased our ability to provide those things we couldn't before, because they have services that involve going to the wards and going to hospitals. So that's like an asset for us now that we didn't have before.
But then you're also an asset for them.
Yes, it works well. We're a good partnership, really. They've got a lot of things that we don't have, and vice versa. So I think it just makes us stronger all round for both charities. Makes us stronger.
But you also mentioned that right at the beginning that there's hopes for expanding into other areas across the whole of South Yorkshire.
Absolutely. I mean, if we could have more buses and more staff, that'd be perfect. Because every time we do an education session or we put the bus in a certain place, we're obviously acutely aware that you're only in that one place for that one day, and that people might be there every day that want to talk to us, but we don't have the number of buses. But we are expanding the service and wanting to get an extra team of healthcare professionals and support staff to be able to go out in other communities in Doncaster and Barnsley and surrounding areas.
Thank you so much. You're listening to Care Across Cultures on LinkFM 96.7. We're coming to the end of the programme. Thank you for listening. Thank you, Wendy, for coming to talk to us and sharing all that information about the Big Purple Bus.
Thank you for having me.
And we will. I will be here next week with some different guests talking about some other health issues. Allah Hafiz. Goodbye, and hopefully see you next week.
Do you want to make a difference in your community? Join the Interfaith Network